kids are using marijuana now, you've got about a 7% THC content level, which is quite a bit higher than it was in previous generations. Marijuana goes by many names, some of which I'm sure you've heard: pot, herb, grass, weed, Mary Jane, reefer, Aunt Mary, skunk, boom, and many, many, many more terms to refer to marijuana. How is marijuana used? Marijuana is most often smoked in joint form. That's a rolled cigarette. And there's a picture here of the dried parts of the plant which kind of shows you how that looks. The second most common way of imbibing marijuana is through a water pipe, also referred to as a bong or a hookah. The idea is that you expose yourself less to hydrocarbons and tars. You look scared, like maybe I'm promoting this. I'm really just trying to give folks information about it. I'll get to the scary parts later. The other ways to imbibe marijuana are through food, tea, or one other way that's popular is through a blunt, removing the parts of a cigar and packing the marijuana plant inside the cigar and then smoking it that way. That's another popular form. Who uses marijuana? You do, not you specifically, but you representing the demographic of teenagers. Very popular among teenagers. Marijuana is also the #1 illegal drug used in this country. And it's also the most common illegal drug used among teenagers. As you can see here, about 15% of 8th graders have used marijuana in the past year, and that goes up to about 40% among 12th graders, which is, approaching about half of all 12th graders have used marijuana in the past 12 months. So what I'm going to cover, given that background in this lecture, is marijuana's short-term effects, marijuana's long-term effects, and the question of whether or not marijuana is medicinal. And again, this is all just by way of you having more information so that you can make an informed decision going forward. So marijuana's short-term effects. First of all, let's talk about its effects on mood. It's always important to acknowledge when you're dealing with an addictive substance that it has a positive effect. If it didn't have a positive effect, people wouldn't use it. The way that marijuana enhances mood is by elevating mood, euphoria, the high, also reducing anxiety. But marijuana can also have negative effects on mood. It can cause anxiety, it can cause paranoia, or a kind of a fearfulness. It sort of depends on your own chemical substrate, how you would respond, but also how many times you've used, and also potentially whether or not the marijuana was laced with something else. So the impact on mood can be both positive and negative. However, the impact on judgment, memory, and motor function is all in the negative in the short term. People tend to have impaired judgments when they've been smoking marijuana. Their memory, especially their short-term memory and their ability to learn anything, goes down. There's a decrease in coordination and reaction time with marijuana use. There's also a decrease in pain perception, meaning that you experience less pain when you've used marijuana, which it could be potentially positive. Appetite increases, also known as the munchies. Time perception increases, so people will tell you when they use marijuana, they feel like time really slows down for them. Heart rate also increases after use of marijuana. How about marijuana's long-term effects? When I talk about long-term effects, I'm talking about people who use marijuana on a regular basis over many weeks to many months. Marijuana's long-term effects are almost all negative and considerably negative. There are respiratory problems that arise from using marijuana on long-term, on a habitual basis. Cognitive impairments ensue, meaning problems with memory and thinking and judgment. Mental illness has been associated with marijuana use on long-term. Obviously, there's the risk of addiction, meaning compulsive use despite consequences. And there's also something called the amotivational syndrome that can arise with habitual long-term marijuana use. And I'm going to talk about each of these just briefly. So marijuana and respiratory problems. There are actually more hydrocarbons and tar with smoking marijuana than you get with a cigarette. Hydrocarbons and tar are the components of smoking anything that are linked to cancer and other significant respiratory diseases. There's more lung irritation, bronchitis. The question of whether your risk of cancer is elevated with marijuana is still up for grabs. Evidence is mixed. but I suspect in the long term we will see that your risk of cancer, just like your risk of smoking nicotine, goes up with marijuana use. Marijuana and cognitive impairment. So marijuana attaches to the cannabinoid receptors in the brain, which are distributed throughout the brain, but also very much so in the hippocampus. The hippocampus is the region of the brain that's necessary for long-term learning and memory. And using marijuana chronically adversely affects your ability to remember and to learn. Reasoning, judgment, planning, these all become diminished with chronic long-term marijuana use. Marijuana use long-term has been linked to mental illness. Depression goes up in people who use marijuana chronically. Anxiety goes up. Perhaps the most significant amount of evidence is linking marijuana and psychosis. Psychosis is a psychiatric syndrome whereby you lose touch with reality. Examples are you hear voices other people don't hear, see things other people don't see, or believe that people are out to get you, conspiring against you, also called paranoia. So what we see in this graph right here is that the number of reported occasions of marijuana use, as that goes up on the x-axis, the risk of schizophrenia, which is a psychotic disorder, also goes up. And these have been in prospective studies. So it's not necessarily cause and effect. We don't know for sure that using marijuana causes psychosis. It could be that people who are vulnerable to developing psychosis are also vulnerable to smoking marijuana, but we do know that these things are linked. Marijuana and addiction. Huge risk of addiction with marijuana. How do we define addiction? Addiction can be broadly defined as the 3 C's: consequences, compulsion, and control. That means you use the substance despite adverse consequences, either in your social world, in your professional world, as a student. You use the marijuana even though you tell yourself you're going to cut back, even though you tell yourself you're going to stop. You have a compulsive inability to stop using. And then control. You tell yourself you're not going to use, but you use more than you plan, and your life is generally out of control because of your substance use. 10% of folks admitted to addiction treatment programs reported marijuana as their #1 drug of choice to which they were addicted. And about 60% of those admitted to those rehab units were less than age 15, which is really startling. What that tells you is that when it comes to addiction, marijuana is really the drug of young people. Withdrawal. Withdrawal from any addictive substance is characterized first and foremost by anxiety, irritability, and insomnia. And the important point I want to make here is a lot of times folks will tell me as a treatment provider, I have to use marijuana because if I don't use marijuana, I'll feel anxious, I won't be able to sleep, I'll get grumpy, sad, irritable, even suicidal. And what I always tell my patients is that is part of withdrawal. So when you have been using habitually and you stop using, you will feel all of those things. And by using marijuana again, what you're really treating is the withdrawal. If you can get treatment and wait long enough and not use, you will come out of that just simply by being clean for some period of time. The other point I want to make here is that the effects of abuse are long-standing. Here you see a picture of a person who has not been using drugs. This is a picture of their brain. The yellow parts are the active regions. This is somebody who's been abusing an addictive substance for a week, and you see their brain is a lot less active. Here's 3 months after the abuse has stopped, the brain is still a lot less active. So substance use, if it's long-standing enough and severe enough, can cause brain changes even after you've stopped using the substance. One of the most subtle, thank you for laughing. So this, some of you might recognize this. This is from a modification of Michelangelo's Sistine Chapel ceiling. And what you have here is a young man who's reclining, and this is a bong or a hookah. It's a water pipe for using marijuana. And he's got his munchies, potato chips, and his lighter and his thing. And he's holding out this water pipe to none other than God himself. And can't even be bothered to get up to give it to God when God comes requesting it. And the point that I want to make here is that one of the, I think, the most damaging aspects of marijuana in particular, as compared to other addictive substances, is something we call the amotivational syndrome. So a lot of people say, well, marijuana is not dangerous, it's not bad, you don't have, it's not like alcohol where you can get behind the wheel and, and kill people. first of all, there's debate about that. There are motor impairments that lead to, increased injury while driving. But perhaps the most damaging aspect of marijuana use is this amotivational syndrome, where people just don't care anymore. All of a sudden, they kind of drop out of life. The goals and dreams they had set for themselves don't become important, or not as important as they were. And in fact, there's a lot of evidence showing that habitual chronic marijuana users have decreased educational outcomes. They don't do as well in school. They have decreased job performance. They have decreased work attendance. So when I talk to folks about marijuana, I want to emphasize that the negative effects are really insidious and subtle, but over the long range can really lead you to have a life that was not the life that you intended, and not the life in which you achieve the goals that you set out to achieve, and that's this amotivational syndrome. The other thing that I think it's important to convey is that you, as adolescents, are at a particularly vulnerable time in your brain development. So what happens in late adolescence is there's a process in the brain called pruning, by which your neurons are cutting back where only the essential neurons are remaining, and everything that you don't use on a regular basis is kind of eliminated. Also, your neurons are being myelinated during this time, which means that they're laying down a sheath so that those neurons can fire faster. This is a critical time of brain development in adolescence. And this basically shows that this demyelination process occurs between the age of about 11 and 20, when the brain is changing. Essentially, if you are using addictive substances during this time, you are potentially doing long-term irreparable damage to your rapidly changing brain. Okay, so very quickly, just to finish up, because of Prop 19 and all the interest in medicinal marijuana, marijuana is medicine. So it's not FDA approved. That's the supervisory board that approves all the medications that the doctors can prescribe. And marijuana is not marijuana as the hemp, as the plant in all its 400 active chemicals, is not approved for medicinal use in this country. You should know that smoking anything is bad for you. Even if there are some therapeutic components to THC, smoking it is not going to do much good for your body or brain. There are synthetic forms of cannabis, such as Marinol, which are FDA approved. So they have taken cannabis and just taken out THC and made a synthetic form, and that is approved for anorexia and AIDS and for nausea and vomiting and chemotherapy. But as of right now, marijuana is not approved for medicinal use by the FDA. Okay, and so basically I hope that coming away from this brief presentation, you can appreciate both the positive and negative short-term effects of marijuana, that you understand something about the long-term effects of marijuana, all of which are negative, in particular this amotivational syndrome, and that you know that although marijuana may have some potentially therapeutic effects in specific populations, in its synthetic isolated form, it's not approved for medicinal use as the hemp plant. Thank you. I just think there's a huge lot of people who use it and